Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video and hidden secret number 3 of why you can still have back pain. In this video, in hidden secret number 3, we're going to talk about trigger points. A trigger point is a small, intense muscle spasm that can cause referred pain to other parts of the body in a very predictable pattern. Trigger points were first really researched in the 1950s by Dr. Janet Travell. Dr. Travell was a medical doctor, and she was one of the most holistic medical doctors of her time. And she was actually also President Kennedy's personal physician who took care of him with his back pain. Dr. Travell published a couple of books on trigger points where she and her research assistants had mapped out all the different trigger points throughout the body and where the referred pain patterns are. And I want to tell you a little bit about referred pain for a minute. Referred pain means that the pain is traveling. So if you press into a trigger point, it can cause pain in that particular area, and it can also cause pain in another part of the body. So for example, sometimes people can have trigger points in the base of their skull, in the top of their neck where the neck joins the back of the skull. That's called the suboccipital group. And in that area, if you press in that area, if you have an active trigger point, it can actually cause pain to radiate up the back of your head, causing head pain. Sometimes people that have trigger points and the muscle right here, the trapezius, when you press into that, if it's an active trigger point, it can cause pain that goes up into your eye or into your jaw. So these pain patterns can sometimes appear somewhat weird, but they have actually they've been mapped out a long time ago. Dr. Travell's treatment for dealing with these problems involved spray and stretch techniques as the primary method of fixing these problems. So what she would do is spray the muscle with like a cooling agent while she stretched them. And the cooling agent would kind of shut down the pain a bit while she was able to break up the trigger points. And that was kind of a manual method of doing it. And in extreme cases, she would rely on lidocaine injections. There was another pioneering researcher that helped develop trigger point therapy who was a chiropractor named Dr. Raymond Nimmo. Dr. Nimmo, a 1926 graduate of Palmer College of Chiropractic, had been working on his own to map out trigger points and to come up with a system to reduce trigger points and to help people feel better. And Dr. Nimmo's approach involved using what's called ischemic compression or acupressure. And so what he would do is he would take his thumbs and press into the trigger point, causing the blood flow to the area to basically shut off, a process called ischemia and compression. And then when he released the pressure, blood would rush into the area and wash away all those toxins that were causing the trigger point formation in the first place. And these toxins are things like histamine, substance P, and bradykinin, all of which are pro-inflammatory and highly toxic. And today, years later, we find that pretty much everything that Dr. Nimmo said way back in the 1930s and 40s is true. And sadly, his name has kind of been forgotten by most historians and not real mentioned too often outside the circles in chiropractic. Today, when people have muscle pain, they go to their medical doctor and they give them a very nonspecific approach to treating the problem. They give them muscle relaxers and pain pills, and sometimes these agents can help, but usually very temporarily. They're also highly toxic, and in certain cases, they can lead to dependency. In my office, I take a very different approach to dealing with trigger points. In my office, we use chiropractic adjustments to restore motion to the joints. And remember, all the muscles are attached to the joints. So when the joints are stuck, when they're not moving correctly, it causes asymmetries in the muscles that can cause problems. We also use acupressure and a variety actually of different manual therapies to break up the trigger points. That includes using instruments, very specific instruments to kind of like scrape the muscle, and it's a very gentle technique to actually break up the trigger points. It's very effective. And I also use Dr. Nimmo's techniques in my office. In addition to that, we use kinesiotaping, which is a system of helping them to stabilize the muscles so that trigger points don't keep coming back. It's a very effective form of helping those problems. I also work on helping patients with nutritional problems. A lot of times what's the driving cause of these trigger points is nutritional issues such as detoxification problems or nutritional deficiencies, such as problems with calcium or potassium, which largely govern how much tension is on the muscles while they're at rest. So if you're having problems nutritionally or you're having problems detoxifying your body, you will lead to having problems with your muscles and lead to trigger points. And also, finally, I find that people that are deconditioned or they have weaknesses or stabilization problems in their spine, that can be the driving root cause of what leads up to trigger points. So sometimes it's not enough just to work on the trigger point. Sometimes you have to work on the root cause of the problem to offer people a permanent relief of their pain. Well, I hope you enjoyed this video and I hope you learned something. If you have any questions about trigger points or back pain, please feel free to communicate with me. I can be reached through my office or through my website at redapplewellness.net. Please subscribe to my YouTube channel and tell a friend. And again, thank you very much for checking out this video.